Hello everyone and welcome to my video presentation today on Class 4 laser therapy for improved cell and tissue health. This slide deck runs about 39 slides, and this will give great information on Class 4 laser therapy for improving the health of cells and tissues. My vision is this. Class 4 laser therapy will be an integral modality in all fields of healthcare. Since our beginning in the United States more than 15 years ago, starting in chiropractic in human medicine and a little bit in veterinary medicine, we have seen Class 4 laser therapy grow substantially in the United States and around the world, being used by medical doctors and pain management clinics, chiropractors, of course, and osteopaths, sports medicine practitioners, athletic trainers, as well as dentists, hair transplantation specialists, and other fields of healthcare. Class 4 laser therapy is a modality that is here to stay. I always like to recognize some of the pioneers and the giants within the profession and the reasons why we are all here. At the top left, Theodore Maiman was an American engineer and physicist who's given credit for the invention of the laser. Maiman's laser led to the subsequent development of many other types of lasers. It was in May of 1960 when he successfully fired his laser. The top middle is Dr. Andre Mester. Early on in his experiments, he implanted tumor cells beneath the skin of laboratory rats and exposed them to a customized ruby laser based on Maiman's earlier model. Now, to Dr. Mester's surprise, the tumor cells were not destroyed by doses of what was presumed to be high-power laser. Instead, it was observed that in many cases, the skin incisions made to implant the abnormal cells appeared to heal faster in treated animals compared to incisions of control animals that were not treated with the laser light. And other experiments, he showed that experimental skin defects, burns, and human cases of ulcers arising from diabetes, venous insufficiency, and infected wounds also healed faster in response to his laser treatment. The top right is Dr. Glenn Calderhead. He is given credit for coining the term low-level laser therapy, or LLLT, in 1988. When he introduced the term low-level laser therapy to the medical scientific literature so many years ago, he was referring to the reaction at the tissue and not the output power of the laser device. At the bottom left is Tina Karu. Some call her the godmother of laser therapy. She worked at the Laser Technology Research Center of the Russian Academy of Science in Moscow. And she is the one that determined the action spectra for cytochrome C oxidase, which has been identified as the primary photoacceptor in photobiomodulation. In the bottom middle is Michael Hamblin, PhD. He's a principal investigator at the Wellman Center for Photomedicine, Massachusetts General Hospital, and an associate professor at Harvard Medical School. He's published over 320 peer-reviewed articles, over 150 conference proceedings, book chapters, and international abstracts, and he holds 10 patents. And then at the bottom right is Dr. Praveen Irani, who is the current president of the World Association of Laser Therapy. He works at the University at Buffalo, and his current work centers on transitioning the research from proven animal models to human clinical trials. So those are 6 of the giants. I like to use the phrase standing on the shoulders of giants. These are 6 of the giants in the field of photobiomodulation. What is photobiomodulation? We see the definition here. Now, for so many years, the process of applying red and infrared laser light to the tissues was given so many different names, but thankfully there was a worldwide panel of experts that agreed on the term photobiomodulation. Now, it should be noted that the basic investigations of Dr. Andre Mester into this phenomenon known as biostimulation have shown that far from active stimulation, many of the processes observed, such as pain suppression, are in fact inhibition. Therefore, it's more customary and it is a better term to call this process photobiomodulation. And one interesting comment that I've heard at a conference several years ago is that photobiomodulation sees the path to health as a physics problem, whereas modern medicine sees the path to health as a chemistry problem. Interesting comment. What happens during these photobiomodulation treatments? The basic effects are to create better blood circulation in the tissues and getting the release of more oxygen to the tissues and stimulating enzymes inside of the cells in the body to help the cells produce more cellular energy. The net effect of all of these effects, plus all of the other myriad effects that are happening during laser therapy treatments, is better healing, pain relief, inflammation reduction, and enhanced and accelerated tissue healing. Here's a wonderful set of pictures to show you what happens before, during, and after Class 4 therapeutic laser treatments. This patient suffered from diabetic neuropathy and peripheral arterial disease. And it's very easy to see in the picture at right how the circulation has been improved, overall tissue health improved. And also, this patient would report to us that their peripheral neuropathy symptoms have been greatly reduced. Now, sometimes people will refer to the process of laser therapy as being anti-inflammatory, and that is not the best term because photobiomodulation does not reduce inflammation in the same way that non-steroidal anti-inflammatory drugs do. Rather, it is better to say that laser therapy helps the body progress through the stages of inflammation, proliferation, remodeling, and maturation more efficiently. The implication of this is that we can use photobiomodulation treatments on acute injuries, and also we can apply the therapeutic laser treatments immediately after regenerative medicine injections, such as prolotherapy, platelet-rich plasma, or stem cell injections. An excellent paper describes the effects of laser in reference to inflammation, with the lead author being Dr. Rodrigo Lopes Martins from Brazil. He comments that photobiomodulation significantly preserved mechanical behavior of inflamed tendons, whereas NSAIDs did not. And photobiomodulation significantly accelerated tendon healing, whereas the prescription drugs did not, I should say. Also, Dr. Lopes Martins comments that photobiomodulation actually resolves and does not inhibit inflammation. Now, I am a proponent of Class 4 laser therapy. I'm a proponent of photobiomodulation. What makes me so optimistic for the future is that in the past few years, we have seen an exponential increase in the number of new articles introduced, in the total number of photobiomodulation articles in the literature. And what is perhaps even more exciting is the number of studies appearing in high-impact journals such as The Lancet, Nature, Circulation, Diabetes Care, the Journal of Investigative Dermatology, the British Journal of Sports Medicine, and more. If you are looking for a collection of studies online, one resource for you is an online research library posted at medical.sumislaser.com. And there I have organized these studies into 5 categories: photobiomodulation science, musculoskeletal, neurological, superficial, and other topics. I'm so excited by the studies that examine the mechanisms of photobiomodulation. Now, you remember the name Michael Hamblin from my 6 giants from an earlier slide. In this paper, he says one of the most important chromophores is cytochrome C oxidase. The leading hypothesis is that the photons dissociate inhibitory nitric oxide from the enzyme, leading to an increase in electron transport, mitochondrial membrane potential, and ATP production. Another hypothesis concerns light-sensitive ion channels that can be activated, allowing calcium to enter the cell. So there are many different ways in which laser therapy is able to improve tissue healing, many different mechanisms at work here. Another of my favorite papers by Prindisi and others states, numerous studies over the past several decades have shown beneficial effects of light therapy. These effects include stimulation of neuronal growth, retinoprotective effects, cardiomyocyte protective effects post-ischemia, and more. So exciting. Here is a graph from the paper by Prindisi showing that photobiomodulation has a positive effect on all time frames and all stages of healing. Now, we recommend that laser therapy treatments are delivered immediately after any acute injury or trauma or post-surgically. But realize that these benefits of laser therapy will work minutes, hours, days, weeks, and months, helping with tissue healing. Another look at the mechanisms. This is a slide that I've borrowed from Dr. Praveen Irani, another one of the 6 giants that I introduced. And he shows how photobiomodulation mechanisms are at work inside of the cell on the mitochondria and the enzymes inside of the mitochondria. They are at work in the cell membrane, affecting cell signaling and the exchange of ions across the cell membrane. And also, there are extracellular effects affecting TGF growth factor beta 1 and other compounds extracellularly. Now, it's a very common question that gets asked when we start to talk about therapeutic laser. The question is, how deep does laser go into the body? Now, a better question to ask is, how deep in the body can you deliver a therapeutic dosage of light? Without going into a great amount of detail here, I'll share with you that in 2010, we conducted a series of experiments to look at depth of penetration of therapeutic laser light into tissues. This was a poster that we presented at the North American Association of Laser Therapy meeting in 2010. To boil it down, essentially, we can get penetration several centimeters into the tissues with the infrared wavelengths that we use in these therapeutic lasers. A ballpark number is 10 centimeters deep in the tissue. You have about 30% of the incident light remaining. So we are able to treat deep structures inside of the body. Now let's take a look at a few of the studies. We'll start out with some small animal studies. And this one is looking at the dual effect of laser on the acute lung inflammation induced by ischemia reperfusion. Now, ischemia reperfusion injury is a pro-inflammatory event. But notice this study concluded. Laser attenuates the ischemia reperfusion-induced acute lung inflammation, and it favors interleukin-10 production and reduced the tumor necrosis factor generation. So again, pointing out, photobiomodulation, we are enhancing the good guys in this case, the interleukin-10 and other anti-inflammatory cytokines, as well as reducing the bad guys, the tumor necrosis factor. Another study points out that laser therapy should be started as soon as possible after peripheral nerve injury. and that laser therapy helps to improve blood flow. Now, we always recommend treatment from proximal to distal, so showing that we can improve that circulation in the upper extremity, in this case of healthy human subjects. Here's an interesting study that looks at the effects of laser therapy on calcaneal tendon healing. And this study shows that with 95% confidence, some laser is better than nothing at all, showing that even just a small amount of laser applied in this case had a beneficial effect on healing of these damaged collagen fibers. And what is interesting is that with the proper amount, the proper dosage of laser therapy, the tissues become indistinguishable from uninjured tissue. In other words, they are as good as new. And that offers us great excitement and hope and potential for our patients if we can use therapeutic laser light to help them become as good as new after injury. This study from The Lancet showing that laser therapy reduces pain immediately after treatment in acute neck pain and for up to 22 weeks after completion of treatment in patients with chronic neck pain. This study was important because it was conducted on human patients, and also it was the first major laser therapy paper published in a major medical journal. This study is interesting in that it looks at laser therapy attenuating lung inflammation. Now, this study was published in the year 2020. Interestingly enough, 6 years before that, there was an individual, a chiropractor from California by the name of Dr. Andy Hall, who was diagnosed with idiopathic pulmonary fibrosis. Rationing and realizing that he had nothing to lose, since pulmonary fibrosis is a terminal illness, he used his class 4 therapeutic laser to treat himself. The good news is, 8 years later, after diagnosis, Dr. Hall is alive, his pulmonary function tests are improving, and his follow-up CT exams show no additional scar tissue formation. So we will talk quite a bit how laser is able to help patients with musculoskeletal injuries, but we have some of these outside of the box cases where laser is able to help, such as this case with idiopathic pulmonary fibrosis. Interesting study looking at how nitric oxide is able to inhibit the replication of the acute respiratory syndrome coronavirus. This study was published in 2005 and showing that nitric oxide is able to inhibit that viral replication cycle. Well, I mentioned earlier that a mechanism of laser is to dissociate this nitric oxide that is bound to the cytochrome oxidase enzyme. And here we do have papers and case studies coming out that photobiomodulation therapy has high treatment potential for COVID-19 infection. Another interesting recent development is guidelines for practice in the management of oral mucositis secondary to cancer therapy. So when patients are undergoing chemotherapy, roughly half of them will develop oral mucositis. What is exciting is that, and we will see some wound pictures on the upcoming slides, so just to give you a warning about that. So we're going to see some open wounds in the upcoming slides. Here we see lesions and wounds from oral mucositis in the lip, the cheek, and the gums. And these were all healed with class 4 therapeutic laser. Inside of the mouth, on the gums, underneath the tongue, on the lips. It's very exciting what we're able to do for these patients. Now, the next slide I'm going to show you is a very dramatic example of wound healing that we can accomplish in the lower extremity. This is a very graphic wound, so just to warn you of that. This is the wound on the bottom of the foot of a patient with diabetic neuropathy, a non-healing wound, and within a period of 4 to 6 weeks, we were able to get that wound healed up very significantly. And imagine the improvement that we offered that patient and how much we improve their quality of life. The next one is a little interesting. This is a testimonial that I received from one of my doctor friends who uses Class 4 laser in his office. Imagine how happy his wife was, and imagine how happy they were that they was able to get reduction in size and significant pain relief from these hemorrhoids. That's so exciting. Now, there are recent studies coming out and indications showing that photobiomodulation therapy does work very well together with the regenerative medicine injections. As Dr. Irani states, besides conventional pharmaceutical, biological, and biomaterial approaches, physical modalities such as photobiomodulation could add an additional approach to the clinical translational regenerative armamentarium. This study showing that photobiomodulation has positive effects on mesenchymal stem cells. This study showing that low-level laser stimulated the proliferation of mouse mesenchymal stem cells without causing nuclear alterations. So the positive effect of photobiomodulation on the stem cells without negative effects. Laser has a synergistic effect in providing greater functional recovery with mesenchymal stem cell transplantation after nerve crush injury. Very, very exciting research, and we will see more of this being done in the future. So what's happening here? Photobiomodulation with a Class 4 therapeutic laser. Treatments are safe and non-invasive. There are virtually no side effects. And as you have seen, that these treatments are effective for both superficial wounds and for deep neurological conditions. The treatments are appealing to patients. It's a high-tech solution that is offered in the clinic. And just to give a comment here, photobiomodulation does not target a specific condition. Now, yes, I've talked about various conditions here, and you've seen wounds and things of that nature, but realize that photobiomodulation does not necessarily target a specific condition, but rather it helps the body to heal itself. We have to realize that the human body, animal bodies, living organisms are self-healing organisms. And the beauty is that photobiomodulation facilitates that healing by helping the body to heal itself. Now, specifically in reference to regenerative medicine injections, when should we laser? Well, number one, before, to use for pain management, to modulate inflammation, and to prepare the tissue for the regenerative medicine injection. And then we can also use the laser afterwards to help with injection pain and then to capitalize on the synergistic benefits between photobiomodulation and stem cells. Laser therapy is now generally regarded as an adjunct to regenerative medicine. Not only will it help the transplanted cell survive, differentiate, and proliferate, but it will improve the general health of the tissue and structures being treated for optimal recovery. So that's my presentation for you today. I will close with a haiku. All coherent light, absorbed by a struggling cell, is victorious. This is Dr. Phil Harrington. Thank you for spending some time with me. Have a great day, and I welcome your questions or comments below. Bye-bye.